for. There's Diane.
Oh, she just got on.
I'm just kind of going through muting people here.
All right.
Oh. Natasha. Andy, the chamber, they want to know if they can control the screen.
When it's their turn, yeah.
And I think they can.
Okay. I don't know if you
Right?
have to, I don't know if you have to like make them a co-host or anything like that in order for them to share. Or I guess they could, if they want to just share their own, that's probably fine.
Natasha, this is Andy. It looks like I can, so thank you.
Oh, okay.
I was asking permission before I took control.
Okay.
Thanks
I'll
for that.
allow
And I'm like, I think so, but I'm not sure.
Don't
I
we have to
will
approve
allow
that
it.
first? We should approve that. I can't just, all right,
I approve it.
okay.
So we just wrapped up our board meeting, as you probably know. Pam, do we have subcommittee members yet, or are they?
Yeah, I'm watching as they come on. I don't see Emily yet.
Okay.
Breevy or
So,
Phil.
yeah.
We'll give them a couple minutes.
Okay. And then Roger, I don't think was going to be here at all, or maybe come on late.
Yeah, I think that's what he said. He might be late.
If you get a document that says that you need to verify your account, and you weren't on unemployment in the first place, you need to contact us because you probably got hacked.
Members who are on the call, you might want to mute your phone. I'm hearing your phone conversation
And see, like,
Skaggs
about
just,
employment.
yeah, I'm through muting people as they get on. So I think we're just waiting on Emily, and then we should be good to go.
I'm here.
Oh, Emily's on. I don't see your name yet.
I had to
Oh, there
go.
it is.
Yeah, we had to refuel.
Yeah.
Okay.
Yeah.
All right. Well, welcome everyone to the COVID Relief Subcommittee for Thursday, May 28th. I want to welcome members of the public, members of the subcommittee, members of our staff. It's a beautiful day.
Danny Carraccio's on.
Pardon?
okay.
Can we have people please mute their lines? Thank
Pam,
you so
you can
much.
mute them, right? Go ahead.
Yeah,
mute, please.
he's muted.
Okay. Was that Skaggs?
No, it was just somebody confirming that
No
they.
Skaggs.
Oh.
You
Yeah.
can unmute and we can listen to
That
your
was
conversation still if you'd like. But anyway, we want to welcome everyone to the subcommittee. It's a great day, hoping to get a lot of work done today for our constituents and our community. So with that, Wayman, will you please
Yes,
the advisement?
sure will. Pursuant to Governor Whitmer's Executive Order 2020-75, the Kent County Board of Commissioners COVID Relief Subcommittee, in order to protect the public health, will conduct this meeting via electronic communications. Any member of the public wishing to listen to the proceedings or provide public comment may do so by using the following internet connection or phone numbers and passcode. It's also listed on the agenda. Any disruptions in the meeting by using offensive language or offensive actions will be muted, and you will be removed from the meeting. You will have an opportunity for public comment. You can reach out at public comment at kentcountymi.gov.
Thank you so much. With that, we want to again welcome everyone. I need a motion to approve the minutes from May 26th.
Support by Breevy.
Moved by Commissioner Talent, support by Commissioner Breevy. Questions or comments on the minutes? Anything in chat? All right, seeing none. All in favor say aye.
Aye.
All opposed?
Aye.
Minutes pass. Commissioner Talon, we are having a little bit of trouble hearing you, so I don't know if that's your connection, but just giving you a heads up. All right, we are going to move on to item 3, a presentation by Latinx GR. Welcome. Sorry, my my agenda left before I could read the names. So sorry about that. Welcome. Welcome Guillermo, and Norris, and Sergio.
Good morning, Madam Chair. Thank you so much for having us once again, you know, in front of the commissioners. It is a pleasure to be with you all. And this time I'm come, you know, representing the West Michigan Hispanic Chamber of Commerce, but I also come representing Latinx GR, which is a group that was originally convened in 2018, you know, as a way for 5 of major Latinx leadership organizations in Grand Rapids to use their collective voice to strategize and to advocate for our community. So we meet as needed, you know, when we organize events, but this unfortunate crisis of COVID-19 has brought us back together. These 5 organizations are the Hispanic Center of Western Michigan, the Latino Community Coalition, the Latina Network, the Latino Network, and the West Michigan Hispanic Chamber of Commerce. We have a presentation that we sent to Pam. Pam, I don't know if you can help us with having the presentation on the screen, or maybe?
I think it's up, yep.
It's up, sorry about that. So if we can go to the slide 3, we are here from Latinx GR to build alliances, to build trust, and to make significant gains. Our goal is for us to be able to partner with organizations and government authorities like yours, and be able to bring the support that our community needs, and be that bridge, you know, for everyone, you know, within the Latinx community in West Michigan. Since the beginning, we connected with Kent County, and we have been able to have a process where we translate and interpret all of the communication that the Kent County, you know, has been released. That has been extremely helpful to our community. So we wanna thank you, you know, for this opportunity that you provided us. And it's working, and our community is receiving the proper message, you know, from our authority, which in this case is the Kent County. We also have, since the beginning, I wanna recognize the work of Wayman Brett. You know, he has worked tirelessly to build this relationship, you know, to connect with us since, you know, last year. And we have been gaining a lot of traction. So a few weeks ago, when the crisis was started, we, Wayman designated Joanne Hugginson from the Kent County Health Department to be that liaison between Latinx GR and the Kent County. Conversations have been great. We have been exchanging a vast of information that has helped, you know, not just the Kent County Health Department, but the community to realize, you know, the extent of this crisis. So we communicate about the infection rates, you know, the testing, and all of the strategy that the Kent County Health Department it's having. So thank you for that. We also are here to represent Latinx business owners. We have seen a number of businesses being in distress with lack of resources, issues with mental health. So that's why we are, you know, here once again with you. And also we come to represent La Lucha Fund, which is a fund that was created to support our families in the Grand Rapids area in Kent County that any funds, you know, from the federal government. So that's, you know, that's some of the things that we're here to share with you. If you can go to slide number 4, and Bo can take it from there.
Good afternoon, all, or good morning, rather. I'm already in the afternoon, Madam Chair and Commissioners. So COVID-19 infection rates, we know that historically, there's been a disproportionate amount of communication between what the Latinx community is receiving and what has been discussed. So when we look at nearly 40% of those tested for COVID-19, out of the 10% of the population, those are the Latinx members of the community. And this is a historical disconnect between Latinx community and health and resources. When we look at issues such as infant mortality in the community, we have the highest rate of infant mortality for the Latinx community in Michigan, and that's a national number. So what do we need right now to combat the spread of COVID in the Latinx population? So PPE, personal protective equipment, what we've seen is as we have distributed personal protective equipment anecdotally from the center's perspective, every time that we receive a donation of PPE, every time that PPE is distributed amongst the population, it is used, it is utilized. It is the fact that it is not being distributed at the highest rates that we see as an issue. Testing for everyone that is either symptomatic, asymptomatic, that have a high disproportionate rate of infection. We need that, and we need ways. There have been CDC guidelines that have been distributed in the community as to what social distancing, physical distancing, and household distancing can be done, but there needs to be funding that follows that. Support and emergency aid for navigation in the healthcare system. There should be those navigators that are embedded within the health department and other organizations to be able to really impact those communities that may be monolingual, to be able to have access to that education and that information. And guaranteed health care. We know that from the governor's office, from the work that we've been doing with the Kent County Health Department, with major health systems here in the city, that we're moving in that direction, but there should be some applicability from the county that sees that and that sees these communities, the Latinx communities, as points that should be engaged at a higher rate. So if you can move to slide number 5. So the analysis, as I stated before, these are historical causes. The lines of communication, and we've tried to address that with the implementation of Joanne as a liaison between the health department and the community. We've been in conversations with many of the persons with everything from rent assistance to the way that we engage. We can't continue to have weak lines of communication. They need to be strengthened. And that's why we're here today, to see that those lines are implemented. Causes like PPE, access to technology, internet connections that should be strengthened, basic needs, those social determinants of health that cause our community to be outside of the streams of communication historically. We can't lose ground. What we have seen and the steps that we have taken with the support of Executive Britt, with the health department, with our commissioners, those are measures that need to be strengthened, and that trusting relationship that we've developed over the course of the last year needs to be moved forward as we see this crisis. And I'll go back to Guillermo.
Yeah, so so if you can please move to the next slide. So in regards to Latinx business owners, as Bo mentioned, we are in need of personal protection equipment. That's that's a serious situation within our community. As you know, many of them have been part of the front line. Right now, 40% of the infections in Kent County come unfortunately from the Latino community. So many of these businesses that continue to operate, like grocery stores, a few restaurants, are experiencing customers, from the Latino community that some of them don't know that they are infected. They are coming. So our businesses are asking us for this personal protection equipment, as we have mentioned. The next point is that over 90% of the Latinx businesses in Kent County haven't received any financial support. This is very concerning, as we don't have a quick turnaround. Every time that a relief fund from the federal government comes, our Latinx business community is not well positioned, to provide the documentation with financial statements and other, important documents that the federal government asks to be able to apply for funds. So that's very concerning. We are coming, to appeal to you today, for help. We don't know if many of these businesses are going to survive. So we want to make sure that that we have funds, that we can distribute through our organization, to the West Michigan Hispanic Chamber of Commerce, to support, the primary needs of these businesses in the next 6 to 9 months. Our business community will be in need as well of technical assistance and wraparound services in the next 6 to 18 months. We are part of other committees, with our other economic development partners, within the city of Grand Rapids and Kent County, and we are talking about rebuilding, our economy and bringing the businesses to a position where they can thrive. So what the Hispanic Chamber of Commerce has done in the last 9 weeks is create webinars. We have a program in place that is called Transformando West Michigan. This focuses strictly in economic development, and we're bringing, resources to our community. But what we would want to ask, from this committee is to help us to continue to build capacity within the West Michigan Hispanic Chamber of Commerce to be able to continue to provide resources. As we continue to go through this crisis, we're seeing many more businesses that come to us for help, for support. So we need to have enough people to be able to respond to the needs. Recently, we were approved to hire 2 accountants. One of the foundations in town provided us with a grant to start an accounting initiative that has been planned. We have been planning for the last 9 months to the Hispanic Chamber. Our goal is to restructure the entire financials of the Latinx businesses in West Michigan. But those are going to be 2 people working strictly in accounting. So what we're asking is for some support, to bring, extra bodies to help us, with responding to the needs. So that's all with Latinx business owners. If we can go to the next slide.
So how does La Lucha Fund help those persons that Guillermo was just talking about? As we look at the business community, we see that 1 out of every 7 right now, it is projected that 1 out of 7 businesses are going to be shutting down. Many of those are those small businesses that may be predominantly Latinx. So Latinx GR, the idea behind La Lucha Fund was to fill in that gap. Those persons that may have been working in the service industry, that may have been working in the cash economy, in the agricultural sector, all of those persons that over the course of time, we know that there's a backlog in the application process for unemployment. We know that people have been waiting. We know that as time goes by, that rent is due, and we want to be able to help and facilitate that. Anywhere between $300 and $500 would be able to effectively help those persons that are facing these issues consistently. So we received 12,000 applications in 2 weeks, mostly by word of mouth. We didn't do a lot of press. We were able to raise $340,000 in a month with kind and generous gifts from the Grand Rapids Community Foundation, the Kellogg Foundation, individual gifts and pledges, many of which were from persons that donated for the first time, that were of Latinx origin, and other communities of color that see this as a way to effectively engage in a solution for a problem that does have components of finance, right? We have nearly reviewed all applications. I believe that as of today, we've received all of those applications. And we've been able to distribute that funding from those. And if I said 12,000, it was 1,200 applications in the first 2 weeks. So we continue receiving requests. We will hopefully be able to reopen with the funding that we are seeking. So we have a total fundraising goal of $750,000, which would allow us to serve between 1,500 and 2,500 more families in Kent County. If we can go to the next slide. So eligibility for La Lucha Fund. You have to live in Kent County. No adults in the household would be eligible for federal aid. Funds would be available via check, or for those persons that may be having an issue with banking or maybe unbanked, we have Visa check cards that we have been able to work with Mercantile Bank on to receive for those communities. And the fund is Latinx led, but anyone can apply, and that's very important. I don't want, or we don't want any misconceptions for it to be stated that it's only for Latinx persons. Anyone can apply that fits that criteria. And again, a disproportionate amount has been for rent. A lot of it has been used for utilities, food and medicine, and other basic needs that cash assistance would help in minimizing the gap that is faced when you haven't received unemployment or other federal aid. So and I'll push it back to Guillermo.
So, so really, the current needs, and next steps, for Latino communities, we have seen, that many of these, things that we have shared with you have been drafted, in the budget. But our call here today is that these funds, should be distributed to organizations, that can, ensure support, that support reaches to Latinx families, in the needs, and that's, we are coming, in front of you, the West Michigan Hispanic Chamber of Commerce, the Hispanic Center of Western Michigan, because through our organizations, we can, distribute these funds. We have direct connection with the community. We are located in the community, and we have the trust of our community, since these two organizations are Latino-led. And so that's, we have seen PPE access, to testing that's in the budget. And the needs that we mentioned before, funds, for the West Michigan Hispanic Chamber of Commerce businesses to combat this crisis. We would like to be able to distribute the resources through our Latinx organization. It is important for us to be able to share, with our community, and to be able to provide for the community that we are part of. One thing that I forgot to mention is that right now we have 3 people, fully bilingual people and bicultural, that are supporting the efforts in economic development. And funds, general funds, to be used by our organizations for the Hispanic Center, for the Hispanic Chamber, to be able to continue to provide resources, so we can build capacity and continue the support, to our community. Bob?
And between our organizations, we've been able to showcase that we've been able to reach and distribute information, education, food that is highly needed in the community to meet that nutritional aid gap that does exist. We want to be able to have more of that, or of those provisions. So supporting La Lucha Fund is one of the best ways that we can do that, to effectively engage a community that has been historically outside of pathways of communication and engagement. We have been able to address a lot of those needs and to distribute information. So we're here to support Kent County. We want to be that bridge. We want to be between the organizations of La Lucha Fund. We want to be able to connect in a way that is authentic, in a way that is critical, and in a way that, Madam Chair, commissioners, and committee, that we can move forward without being exclusive or excluded, but being inclusive as a community. So,
all right,
thank you for your time.
we have a pretty packed schedule, and I know that we've got questions for you guys. So if you don't mind, I'd like to move on to that portion. I have 2 right off the bat while I wait for some hands to go up. First question, well, on slide 4, I just saw a red flag because I worked in the legislature on Medicaid, and then I also work at Spectrum. So I have some hospital context. So I'm very concerned about item 4 and 5. I think we need to make sure we're connecting your organization to our county DHHS office. If that's not happening, we need to make sure that happens because that is a huge glaring problem that I'm very concerned about, and I want to be sure we can talk offline. But if that's an issue, we will be working to remedy that because that's a problem. The second thing on the guaranteed access for hospitals, a hospital cannot deny someone that presents themselves at a hospital. So anything I can do to connect you, probably through Healthier Communities or Dr. Fawcett, anything I can do if that's a problem in our community. We have 3 wonderful health systems here, and that should not ever happen. So,
and Madam Chair, we've been in communication with Spectrum Health, Healthier Communities, and leadership at Spectrum Health, at Mental Health, and they've been very supportive. We would need more of that communication if possible. And Tracy Fox has been a great ally, and we are in constant communication with them. Work stoppage for those DHS workers that are Spanish speaking has been an issue, and we want to be able to have them. We've had a great relationship with them here at the center to be able to direct a lot of referrals, but that would be great.
I just wanted to be sure because that is not really a COVID issue. That's a long-term issue that we need to address now. And I'm happy to do it, or whoever, Wayman, but we need to make sure that is addressed. So that was my first thing. And then my second question is, how are we, a lot of these issues, a lot of your requests are, I think, going to fall under some of our community action agency. We've got several different funding sources coming into that. So I'm very interested to know what your relationship is like with our department and our staff there. Are we connected? Do we need to improve that? Where are we? Where is your community, and how is it connected with that department?
Which department is it again, Madam Chair?
The Action Agency with Susan Cervantes and our Community Action Agency.
Yeah, they're located on at the Human Services Complex on the first floor of that building. You probably have been there a number of times, but Susan's organization is broader than just the meals that they provide for. I know the Latinx community is participating in that, and as well as some opportunities for trips and rides to different services, I believe. But what she's speaking of is a broader number of services that exist through that organization. We need to connect you.
Yes.
Right.
Yeah.
But we have had communication with different agencies. We're making sure that navigators are engaging in emergency SNAP benefits and those benefits that already exist.
Yeah.
The app is beyond that.
Yeah, I get that. No, I totally understand. We've got this ongoing concern with this effort right here where we've got this fund, but then we've also got 4, I think, different funds coming in that are much more restrictive than this fund that can be applied to some of the needs that you're requesting. And so my ask it has been that we make sure we're utilizing those to the best and maximum capacity and ability first before and then use the CARES funding to plug those gaps. So that's why I just asked. I just want to be sure we're all coordinating and you're connected, and and then I have to give Guillermo some kudos, because the last time he was on, he gave us an awesome idea for kind of a countywide Wi-Fi effort with hotspots. And so that's something a lot of our subcommittee wants to do. And I'm so glad that you came in and shared that with us, because that's an awesome idea. And we really want to push that. So I'm just thrilled that as sad as this issue is and this pandemic, that we're able to continue to build this bridge and communicate and continue to work together, because it's going to be much better if we work together. So
thank you so much. Thank you so much, Madam Chair. I'm excited to hear those great news.
Yeah. Commissioner Steck has a question.
Thank you, Chair Bolter. You actually raised a number of the questions that I was contemplating. And the thing about crisis like this is it sort of accentuates where there may be weaknesses in our systems. And So even apart from the current funding conversation, it strikes me that the observations and comments here from our presenters, and thank you for that, suggests that we need to identify how to better connect. You mentioned KCCA, connecting some of the programming and the funding that's available through that, as well as through our health department and Network 180. I think, Guillermo, when you were here last, you mentioned that, and I did ask Network 180 to reach out to you directly, because I think that's a concern that some of us have, that we do have availability there. We just need to make sure we connect that up. So, so apart from this funding, thank you for those observations. And I think we need to stay tuned to how we can better improve those communications and access.
Thank you so much, Commissioner Stanley. We have connected to Network 180, and my program manager for Transformando West Michigan Initiative and myself, are going to be developing a strategy, with them, to support our business owners. Thank you so much for that connection.
Okay. Commissioner Talon.
Thank you, Chair. Can you hear me okay now? Or?
You're really muffled.
How about now?
That's a little better.
Okay. I apologize for the technical issues. The remarks by our presenters this morning and follow-up by Chair Bolter and Commissioner Steck both illustrate what is an ongoing problem, and that is access for certain segments of our community. And it's an ongoing issue. We're not going to...
Can't hear.
Commissioner Talon, we're having a really hard time hearing you. I don't know if you want to type it in chat and I can ask the question.
One last try. Is it?
No, it's super muffled, and it sounds like you're in another. It sounds like you're three rooms away.
All right. My apologies.
I'll call Commissioner Womack. Commissioner Womack.
Yes, thank you, Madam Chair. Yes, I definitely want to thank you guys for this presentation. It is great. It's enlightening. It's educating. It's definitely showing us some ways we can be a part of the help when it comes to this COVID-19 in that community and the other people that are eligible for help through your programs. One of the questions I want to ask when it came to eligibility, and it said those eligible for federal aid are not permitted to receive those funds. Could you talk about what type of federal aid you would mean? Would that be federal aid as the stimulus, or would that be any federal aid programs?
Yes, it's any federal aid programs, programs from the PPP, programs to support businesses from the SBA that has come, from the federal government, even funds from the MEDC, from our state. We haven't been able to access those resources. And a lot of people also can't benefit, from the stimulus checks.
And there are people that have applied that are within that gap in funding. So the focus is really to be able to help and adjust that gap in funding that we've seen for so many people in the community. So, that's the focus.
So when we talk about federal funding, but when we talk about federal aid, if it was, did it say federal financial aid? Because if it says federal aid, would that also mean like health insurance that comes through the federal, those type of aid and programs that may not be financial? Would they be ineligible because they were on Medicare or things like that?
During the application process, there's a group of persons that look at all of that different criteria, and they're able to say, yes, there is a need, or no, there is not a need, because you're applicable for different things. And then we help navigate through those different systems. So there's a method that is being done to adjust to say who does receive the funding, who is really in dire need of the funding, and who is not. So they look at all of those different things. If they're able to address that with some additional funding, if we're able to direct them to other groups that are doing the Grand Rapids Mutual Aid Fund, for example. So if we're able to direct them in a way that they would be able to receive outside funding, to make sure that this fund is specifically utilized for those persons that are most at risk, that have the least amount of support that is available to them.
Okay. All right. Thank you very much. It's because when I saw the federal aid, I know federal aid, those tentacles stretch, and most of the families that are in poverty receive some type of federal aid, even though it may not be financial assistance, you know. So thank you very much, and I'm glad that they take a closer look at that. Thank you very, very much, and thank you for coming in.
Commissioner Talon, did you rejoin us via phone? I don't.
I did, Madam Chair. Can you hear
All
me?
right. Now we can hear you. Yes.
Thank you. I appreciated the suggestion to call in on the phone. I just wanted to recognize that the issues that have been raised here about access to resources that exist are not new, and they're ongoing. They're not related totally to COVID. They've been going on for a long time, and we've heard about them for a long time. And I really feel like we have an opportunity here to utilize the resources that exist in our community to break through some of those access issues. You see the work that the Hispanic Chamber is doing. I've seen the work that the Hispanic Center is doing in providing access to food and other resources. And I really see an opportunity here to do something different, and hope that we can utilize these organizations in some way to reduce some of those numbers that are totally related to access to resources that exist in our community and are available.
Okay, and then I have one last question and we'll let you go because it relates to everything we're doing on this subcommittee. And I've said it a lot of times in our K-Connect meetings as well. If let's say I'm a single mom and I moved here 6 months ago, and I'm not, I'm worried about the immediate hemorrhage in front of me, my kids, getting my kids to school, my job, my rent. I'm not real connected to the community. How are we reaching people who don't know about Hispanic Center or don't know about organizations like that? Because I'm very concerned, and that's why I was so thankful to have Commissioner Womack bring in the presentation we had on Tuesday, because it got granularly down to the neighborhood level. And I just want to make sure we're doing something for meaningful and effective communication, because otherwise it's always just going to get to the people who are involved in the Hispanic Chamber or involved in the Hispanic Center, and not down to that struggling mom or that struggling family who maybe just isn't connected in a community way.
And that's where I think the strength lies with the organizations and the trust between the different organizations. So when you have the Hispanic Center working in concert with the Hispanic Chamber, working with Latino and Latina Network, working with the Latino Community Coalition, that's where the strength lies, that we're able to then broaden the scope of what it is that we achieve, making really authentic relationships over the course of the last year and a half with Executive Britt, with different commissioners that are on the call, working with not only the Hispanic Chamber, but the Grand Rapids Chamber, to be able to elevate what it is that we do, working with projects like the New Americans Project that engage the county, the city. So just being visible. I know Guillermo has been doing amazing work with that college-age student demographic, working with all of the businesses to create pathways. We have been working on the human side because, like I stated earlier, those persons that work directly with business and the chambers work with us from the human side. So we've been doing everything that we can in building authentic and real relationships to make sure that that accessibility is there.
Yeah, I just want to be sure. Oh, I'm sorry. I just want to be sure we're building in all these efforts a rock solid, effective communication plan, because otherwise it's just going to organizations and it's not getting down into the grassroots of the community. So
Yes, Madam Chair, if you allow me to add, as Bob mentioned, when we come together, all of these organizations, the Latina Network, for example, has over 600 ladies that are part of that organization, the Latino Network, the Latino Community Coalition. So you have a big network, and many of these individuals work at GRPS, at the City of Grand Rapids, at different, companies and organizations throughout, Kent County. So that's how we connect with each other, and things are shared within our groups, and when we hear about certain needs, we reach out to each other. So.
Okay. Yeah, that's just a concern for all of us, because we're doing this so quickly, as intense as we are doing it quickly, and we want to get the relief out quickly, and we want to move, but we also want to be sure that we're achieving our goals. So, all right, with that, I think we're going to move on. Thank you guys for your presentation. Thanks for coming in. Thanks for all you're doing. So thankful for what you're doing, and hope to connect with you again soon.
It is our pleasure. Thank you for the space that you provided us today. Thank you so much.
Thanks, Guillermo. All right, we are on to item 4, Grand Rapids Area Chamber of Commerce Small Business Relief Support presentation. I think we're joined today by Andy Johnston and Dante. I'm not sure if Rick's here today.
No, Madam Chair, unfortunately, Rick can't join us. But so you're stuck with me and Dante, but I think we'll be able to cover it. I'm going to try to share my screen here. It says I can't do it while Natasha's doing it. So maybe if she can take down her screen. There we go. Let's see. Oh my gosh, I think it might be working. I just wanted to take control because I know time is short and I really want to get to it.
Can we ask participants to please mute? Thank you.
Thank you. It wouldn't be a Zoom call without one or two of those.
I know.
So
I feel like it could be, a fun game where we see how many times we can say it.
Well, thanks for inviting us today. You heard from Rick Baker, our president and CEO, at a previous meeting. We're excited to continue the conversation because we've learned a lot about supporting small business through this and what we did through the Grand Rapids Chamber Foundation to stand up a relief fund. So what we want to do today is focus on what we've learned, our experience, and give some suggestions as the county's thinking about ways to support small business going forward. I think what we heard from Guillermo and Bo today, I think we're seeing the same thing with our small businesses. I think also the discussion today shows the silver lining and benefits of working through this all together. We're increasing the already great collaboration happening in West Michigan. We're identifying these areas and being very creative in finding ways to solve it. And just want to thank the hours that this committee is putting in, and man, the team at Kent County, Wayman, Lori, everyone, Adam London, of course, at the health department. It's been really special, and these kind of times really show leadership, and so we're really grateful for that. You don't need to see our faces because you'll see them. So we're just going to cover a little bit of the why that Guillermo and Bo talked about as well, but also what we did at the foundation and the Rapid Response Relief Fund, and then some of those recommendations. So, the why. This is why organizations like the Chamber exist. We've been around since 1887. We formed to address problems. The initial problem we were trying to solve was the railroad companies were charging our furniture industry too much. So we got together and we're able to collaborate and lower those rates and create a climate for success. And we're doing that now through this pandemic. The businesses we've assisted has been just truly heartwarming to hear to try to reach out to those businesses in need and offer them the guidance and the support and the resources that our team can do during this time. So it's been incredibly rewarding because this is about people. We talk about business a lot, but when it comes to supporting businesses, you're really supporting people. And it's about supporting job retention through this. That's what supporting, small business means. It means, putting in money in the pockets of the people and the workers throughout our community. that create the energy and the vibrancy and the tax revenue, right, that our local governments they're able to support our governments with. And I just want to say, we've been very intentional about assisting members, non-members, anybody who needs support, whether it's Kent County, Ottawa County, Montcalm County, Barrie County. We're trying to help them through this. And just to build upon what we're hearing, if this continues too much further, stay-at-home orders, a significant chunk of our businesses are unsure or don't think they can survive. And when we look to the future, many of our businesses are saying it's going to take a while for the economy to bounce back. I think that second chunk of folks saying the economy's not going to bounce back till 2022, 2024, we know that the need is significant and it's going to be around for a while. So we're really excited about this discussion about cash flow support. As we've set up our relief fund, we've identified this as one of the biggest issues amongst these other items in our restart agenda that we're working on. And the county's been a great collaborator on a lot of these as we moved forward. So I really want to talk about the relief fund that we set up and talk about how our team was able to step in, not only provide cash support, but also technical assistance. And for that, I'm going to turn it over to Dante, our Vice President of Business and Talent Development, to talk about that. Dante?
Thank you, Andy. And buenas tardes a todos, or buenos días a todos. Good morning to all. In the days after the first stay-home executive orders that were issued, we saw firsthand what happens to businesses when their revenue comes screeching to a halt. When it's not down, it's actually zero. They're receiving zero revenue, yet their fixed costs are still there. The sustainability of these businesses really comes into question. So that we have was to address that. It was to support small businesses, for-profit businesses with 5 to 25 full-time equivalent employees. We gave out grants from $5,000 to $10,000, but also provided technical assistance to help them navigate these difficult weeks that were going to prove whether they come back or do they not come back. We were able to create a process to fund close to $1 million in grants to over 120 some different businesses. And we'll get a little into that in a moment. But what I wanted to share with is that we developed a proven process that was very effective because it brought 3 very key pieces of the puzzle together. And that is the people, the process, and the technology. So I'll start quickly talking about the people. The people's critical to this. We needed to have subject matter experts in a variety of different areas, which we do at the Chamber. I myself have been in economic development for the past 20 years, 16 of those years leading the Small Business Development Center at Grand Valley State University in 13 different counties. We had bilingual staff. We have 3 bilingual staff that also have banking backgrounds, financial backgrounds, such as Omar Cuevas and Yadira Garza Malone. We have individuals that are certified business consultants, such as Mark Allen. We have our Director of Inclusion, Ken James, who's also a certified inclusion mentor, one of the few in the country. And then we also have a CPA on staff that assisted us in making sure that the funds were allocated as they needed to be and that the accountability was there as well. But the big piece about the people that I want to stress for any success, including what my colleagues Guillermo and Bo have shared, is the outreach efforts are key. You need to have the right people to be on the upfront of this to make it happen. And then the process was intentional, it was rapid, it had an equity lens, and there has to be integrity and accountability. And it also cannot be duplicative. We need, the resources are scarce, so we need to make sure that it's going to those who have not been able to access the other funds that are available. And then a key piece of this is the technology. The technology to have an online platform. We utilize the technology that's based from Qualtrics that Calvin Research assisted us with, where any applicant, any business could apply via their phone online. They could take snapshots or pictures of their financials and upload them in a secure way to our database. And then, of course, when we reviewed the applications, we utilized a Trello board where the review committee signed in and saw all the applications along with the rubric. So they're not printing things out. We're not sending them emails with all this confidential information, highly sensitive confidential information. So that was critical to the process. And if you go to the next slide, you'll see these are the outcomes that we had. 56 women-owned businesses that we served, or 45%. 59% of our grantees were minority-owned, 1% veteran-owned. Collectively, this represents over 1,200 jobs that were saved. And again, up to date, we have funded 125 businesses for a total of $963,000. Next slide, please. Little more breakdown on the ethnicity with our white Caucasian demographic, 48%, followed by Hispanic Latino businesses, 34%, African American, 25%, Asian 8%, and so on. Next slide, please. These are the zip codes representing the businesses that were funded, that were our grantees. As you can see, some of the zip codes like 49503, 49509, 49507. This is the 49503, the downtown wealthy market area, 28th Street to 36th Street and 44th Street, east or west of 131. 49507 South Division, Franklin, and so forth. You can see the zip codes that are there, which we're pleased that it was a very a broad representation geographically as well. And again, I attribute that to the broad outreach efforts. So what do we recommend and how do we continue to support our businesses here in Kent County? We understand that the Kent County Care Small Business program can be very effective. We're proposing that we continue to do this work that we've been doing through this process that we have created. We understand that we have everything in place to do this right and to do it right now, immediately. It would be a fund that would have its own separate allocation. It would have its own separate outreach process, selection committees, metrics and scoring, but it will still utilize our Trello platform that has been very successful in reviewing the applications and the easy to use online application process that we have developed. Next slide, please. So what I feel that is critical to this process is to have an inclusive outreach effort with an equity lens like we have been having. This way I think would allow us to even expand it broader to collaborate with additional entrepreneur support organizations, with all of the chambers of commerce here in our Kent County, and with local municipalities and other units of government that are critical to those respective areas. Our goal is removing barriers to access. It shouldn't be just those businesses that are more sophisticated that should have access to these funds. It should be every business. And again, that's where the subject matter experts come into play. We have subject matter experts that not only for our process, not only walked alongside with them and help them fill out the applications and get the right application to us, but they also provided one-on-one counseling and advice on how to navigate the system and the processes and so forth. That is key. That is key. So if you go to the next slide, there we go, Andy, you're good. There we go. So we understand that geographic distribution is key for the success of these additional dollars. This is something that we will collaborate very closely with the commissioners, with the county, on creating the demographic, the scoring. We have a rubric that we utilize that the review committee went through and assigned points. We can change up the questions. We can add different weights to the questions. For us, it was important to understand what's the sustainability or the chances of them to be able to come back and continue their work as a business. And so we assigned a little more weight to that. This is a rubric that we utilize as well with the with the Right Place MEDC grant. Hey, Christian, hold on, buddy. Oh, sorry. Yeah. Hey, Lisa, can you take Christian over there? Sorry about that. My 5-year-old, my apologies. So we needed to have a rubric that the reviewers can easily look and make their allocations of weight. However, this rubric, again, we would work with the county to adjust some of the questions or put the weights where we feel they're needed. We also would like to look at the full-time equivalent eligibility criteria. Is that we utilize 5 to 25 FTEs, but we could easily go to 0 to 5 or 0 to 25. We understand that 0 to 5 is still needing support and resources, and I think it would allow us to really target that size of business. Next slide, Andy. So how does the committee function, the review committees? I want to make clear that the deciding or the decision on who gets awarded the grants in our process was not made by the Grand Rapids community or the chamber staff. It was made of a community that represented, a committee that represented our broader business community that brought to the table certain skill sets to be able to, first of all, determine eligibility, evaluate the sustainability of the business, and determine the allocation and the priority that the business would receive. We had bankers who've been doing community lending for their careers be on this committee. We had business owners. We had community entrepreneur support organizations also represented in our review committees. We would, for the Kent County CARES dollars, we would propose having committees of 4 or 5 individuals. Every committee, what we've learned, can probably do about 80 reviews, 80 application reviews, and it probably takes about 16 hours for 80 applications to be reviewed. So it's clear to us that we would have several committees comprised of probably a broad representation of the county. And again, that would be at your discretion to let us know who would be on this committee. I can guide the process and I can guide the discussions to get to the people on the committees, but the final say-so would be you. Andy, what I'd like to do is open it up to any questions that anyone may have.
Yeah, and I think we can also show to kind of some of the screen that we have a screenshot of like what the Trello website looks like. I think having a technology platform that makes it's a great way to keep track of everything, get that demographic data, but it's also accessible via a smartphone in a very barrier-free kind of way. As we've thought about this, in terms of like feedback, I think as the county looks to this, we need to be guided. If this goes forward, right? What your kind of decisions make, size of business, what kind of buckets you'd want to think about for geographic distribution. does this committee structure make sense? One thing Dante has shared is that, these committees of 4 or 5 to review the number of applications that they get. It takes a significant amount of time. I believe Dante said about 16 hours to do roughly 84 applications. I think, strong conflict of interest and, confidentiality measures put in place. And then also making recipients public. I think with, one things we learned with the Right Place and Lakeshore Advantage is, do you want to make it, public? I think that that's just a decision this group, the commission needs to make so that applicants know going in that if they do receive funds, it could be publicized. But those are some of the discussion points I thought, are critical to going forward. I know the chair is anxious to move forward, hearing her on other calls, as are others, and we appreciate that. I think, a lot of these resources can go a long way. So I'll stop there, Madam Chair.
Mm-hmm.
You're on mute, Mandy. Mandy, you're on mute.
I said I'm sure everybody's going to have questions, but I always give myself time to give everybody else time to raise their hand, so I'll kick it off. One of the first big questions that we have to answer is we're kind of taking the large fund and trying to create, for lack of a better term, a bucket list of different categories. And we heard from the Right Place that the $1 million that they had to stand up very quickly, and I don't know how long, if it was a week or 2 that their application process was open. And again, what was the communication on that? Probably word of mouth, I assume, but that they received $72 million in requests in that one small slice of time for $1 million grant, $1 million in grants. So, I know that we could apply probably 115 million, all last dime of it, and it wouldn't be enough. But, I'm a little concerned that we've kind of got this placeholder of 10 million. I'm concerned maybe we need to double it. Maybe we need to increase it even more. I guess, what are your thoughts? We do have other obligations. We are going to fund those other obligations, absolutely. But this is key to helping relieve the unemployment on the state. This is key to helping relieve all of government services that can be funded, because we'll then get our tax base going again. And, all these things are interconnected, and they're a domino effect to kind of help us get back to normal, or the new normal. So, just what's your opinion on 10 million? Should it be more?
My opinion is yes. Through our process as well, we saw a lot more need versus the available resource. I do want to share, though, that, and I was a co-chair of the committee that reviewed the MEDC Right Place grants. And I'll share with you that when that grant came online, it was really the first resource to come online in the beginning, right after everyone went home. And even before the SBA got their PPP out, and even the economic disaster relief loans, that the website was crashing and so forth. So that, and their fund was geared for 0 to 50 employee businesses. So I think a lot more. What we saw when ours went live, I want to say about 3 weeks later, we had a more narrow scope, of course, 5 to 25 employees or full-time equivalency. But what we saw was that by that time, many businesses were already accessing other resources. And I would say today, there's a lot more businesses that are accessing PPP and have accessed other resources, including the 3 or 4 funds that have been available. However, I do feel that the need is still greater than 10 million.
Yeah, and I think to answer your question, Mandy, I think 15 would be great. Obviously, 20 is better. I think I think the need is definitely there, and I think, as Dante points out, we want to target those who really need it.
Right.
And when we're talking about need, I think, a $10,000 or $20,000 grant is a lot more impactful to these businesses and bridging them into the future than doing smaller grants. Let's make a difference to bridge them.
Yeah, and again, because we're the county, I mean, we want to be very intentional about reaching every last corner of the county. So the intake and influx of what you're going to get if we do this properly and we engage all organizations and municipalities like Dante mentioned, is I'm just worried that, that may be something that's been, something that's had a lid on it for so long, and it blows up because you've got these outlying communities that really, maybe they didn't have the communication about your fund or, the Hispanic Chamber Fund. And, I just want to think about this as a countywide effort now. So it may require some more assistance. Commissioner Steck has a question. I think you're on mute.
There we go. Sorry. Again, thank you for your presentation this morning. Following up a bit on some of the comments and questions from our chair, my understanding is look at all of our companies, all the employers in Kent County, there's about 8,000. Am I reasonably accurate with that?
We've seen doing DBAs in the county, north of like 30.
Yeah.
Okay, so I'm undercounting substantially. And based on your experience and observation here, if we were to look at all of the needs for all of these businesses, that would be within the profile of what this money can be spent on. What's the magnitude of it? If we were to reimburse everybody for qualified expenses, 15 million doesn't strike me as being anywhere near close enough.
Right, and I think Commissioner, one thing you have to think about one thing we have to consider is what businesses need it now going forward as we've been reopening, and who are those businesses that need that, and kind of peeling that back. I think you're right, the need will exceed 20 million for sure, but it's taking the total business community. Okay, manufacturing's open, Steelcase is calling people back, they've got orders, but what about our main streets that are still struggling, or these businesses that only are allowed to operate at 50% capacity or not at all? Dante, did you want to take a stab?
What I would add is you would have to deduct all those that have already received some type of support, PPP, any type of disaster relief from SBA, from MEDC, et cetera. So it does shrink it down. And like what Andy said, if we focus on those that need it the most, and we could put parameters to help us define what that is and who and how to reach them, we will really be impacting our main streets, our local communities, our neighborhood businesses that are vital for them to continue their presence in the respective communities.
Right. So you're getting ahead of me a little bit, because you're reaching that next step, which is if there isn't enough money to meet all of the needs, all of the demands, what's your thinking? What's your advice as to how we best concentrate the funds that we do have when we ultimately make that bucket decision? Mm-hmm. What are the businesses? What are the quote needs that have the most impact in our community? And I'm hearing you talk about needs from the individual businesses perspective, and that's important, but as policymakers, we look at it from the community's perspective. What's going to have the biggest impact from the community's perspective? And we had that conversation a little bit with the Right Place, and I'd be interested in your thoughts as well as to what are the profiles of the businesses that need to be the primary focus or the first focus.
Mm-hmm. Well, for me, it starts with the employee size and the employment that they generate, because that's a big driver. That's why we had gone with the 5 to 25 FTEs, because we knew that the impact would be the greatest there. 8% of all small businesses are 50 employees on down. So we know that this is a large demographic. But there's other parameters that we could put in place, maybe some industries. We could look at some NAICS codes and determine, okay, these types of businesses are vital for, you know, our communities, or for certain communities. We could also look at population of certain zip codes and determine, okay, based on certain populations, this is the type of businesses we want to support in those specific areas, geographic areas. There's also an opportunity for us to look at the life cycle of the business. Are they a startup? Do we want to focus on startups? Those that are mature, those that have, for example, we asked what were your last 3 years of sales, to determine, were they already on the decline? Were they pretty stable, or were they a very promising business? And none of one takes precedent over the other, but it's what you determine to be where we want to create the most impact. What we do know is that we're not going to be able to serve everyone. That we do know. So
Dante, talk about the profile of the businesses you saw applying.
Yep. So we saw a variety of different industries, sizes, and so forth. I think those that were successful in getting the most points and thus awarded the grantees were those that were showing growth prior to COVID. Those that we also, one of the questions we asked was, are you accessing other resources? Are you connecting with other entrepreneur support organizations? For us, it was important to gauge, are they coachable? Because it's not just the check that supports them, it's the technical assistance that comes with it, and that's key. Are you coachable? Are you gonna meet us halfway? Are you gonna do whatever you need to do to keep your business moving forward? So those are ways that we were able to kind of feel for the types of businesses that we needed to support.
Well, I'm glad to hear that you look at that. I mean, it's a painful reality, but probably more than 50% of new businesses don't survive 3 years. It's just a reality.
One of the questions we also asked was, that was part of the rubric, is how vital is it for this business to remain open in this community? What service do they provide? What percentage of employment is generated through this business for that local neighborhood or whatever? And that was one of the questions that was weighed a little higher.
Chair, if I have one last
Sure.
follow-on. So assuming that we had 10, 15, $20 million into this process, how long would it take this process to facilitate or identify and distribute?
To begin, if we were to begin, let's say on Monday, by Friday, we would have it built out and ready to do the outreach side of it. Simultaneously, we would work with the county to determine the review committees and so forth. But the process is in place already. The technology is there already, and the staff is there already, ready to make it happen. We would be very intentional in creating our outreach process to encompass all of Kent County, including, again, the entrepreneur support organizations, the other chambers of commerce that we collaborate with, and of course our municipalities and townships and so forth. What I would also recommend is that we do 2 phases of outreach. The first one is to work with our partners, all of those mentioned right now, chambers and so forth, to give them a heads up and help them start looking at their communities and trying to identify those businesses that have not received any type of support and how we can get them into the pipeline right away. And then a second phase, which is open, so to speak, to the general public for applications. On both of these, we would have our subject matter experts there to walk them through the process. Even though the application process is simple, we don't want it to be incomplete application that they were denied. What we do is reach out back to them and ask them for the additional documentation we may need, or help them, fill out the other information that is being required. So in short, we can get it up and going very quickly. Probably the biggest delay would be identifying who's on the review committee.
Commissioner, are you set stuck? Commissioner Talon. Jim, are you there? Commissioner Talon?
My apologies. Can you hear me now?
Mm-hmm.
Yes.
Yes.
Sorry. Two questions. One is to kind of follow up on what was just discussed, and that is I'm wondering about the use of the folks that we heard from earlier and the established authentic relationships that they have. It sounds like step one, phase one of outreach would be to utilize them, but these are organizations that are operating on a shoestring, and asking them to do all that additional outreach without some support for that seems like it could be difficult, recognizing that the Grand Rapids Chamber, as has been stated before, has more resources to do that kind of thing. Any thoughts about that would be appreciated.
Absolutely. So when we did our fund to the community, to the Grand Rapids Chamber Foundation, we did work with all of the entrepreneur support organizations. We worked with Grand Rapids area Black businesses. We work with the Grand Rapids Black Chamber. I met with Guillermo and asked him to send me referrals. And this is even before we had our public link that people were applying. So we do have staff. I had two of my staff, Yadira Garza Malone, spent a lot of time working with our Latino and minority communities. Ken James, who's our Director of Inclusion, is very knowledgeable and he actually worked a lot with our faith-based organizations in our community. And I think that's why I really stress if we want an equity lens to be present in our outcomes, we need to have it in the beginning of the process, which is the outreach. And we've developed a way to do so, utilizing, again, our staff who's representative of these communities of color, but also the partners that we work with. And we work with all of our entrepreneur support organizations.
Yeah. And I would just say, even though we've had to furlough staff through this process, about 20-25% of our chamber staff, we're getting higher output, frankly, in some ways, because the need's so great and we're stepping up. I think as you think about funds for this, Jim, if I'm answering your question here, I think our team can provide a lot of the marketing, resource, and support. But also use some of these funds to get the word out. Is it snail mail in addition to email, and all those other ways that we can reach folks, with a DBA in Kent County to let them know that this is available.
Mm-hmm. And one of the last things I want to share to this matter is that we need to utilize the existing channels of programming that we have. For example, at the Chamber, we have several programs that work with our minority-owned businesses, such as Elevate Minority Business. We have 3 cohorts running right now of second stage minority businesses. Our West Michigan Minority Contractors, which is part of the Chamber, our Equitable Contractor Connect program that we have, and then working with the city and county initiatives that everyone touches, and of course our partners as well. So we have to have that intentionality. Absolutely.
I guess I want to just say to my colleagues on this committee that I think that if we're going to utilize the authentic relationships of some of the other organizations that are out there, they ought to be compensated for that. That we typically ask those things to be done. We don't offer compensation, and I think we should. The other, I appreciate the responses. The other issue I want to raise is to recognize that, correct me if I'm wrong, but I don't think we can use these dollars to just provide outright grants, that they need to be used for specific types of expenditures, and wondering what that would look like, what difference that makes in the process, because we certainly can't pay for lost revenue for a business. So what does that look like? I'm not sure if that's question for the chamber or for county staff?
I'll share with you what from the chamber side. So the allocation would be the process would be the same. The allocation amount would be the same, and it is such that we're not able to directly provide the funds to the business. When I was at the SBDC, we used to manage the Business Accelerator Fund, or BAF, that MEDC had, and we did not allocate although we allocated 25,000 for a business, we didn't pay it out to the business. We paid it to the an accounting firm or legal firm or whatever technical expertise they had to pay for to get their business moving. So that should not be a problem with us as well. We can, if that should be the case, we could.
I think the question was on
I don't know if that is the case. I don't know if Steve Duarte can provide us some guidance on that as well. Steve, are you there? Unmute. Wayman,
I do know, Chair, that you can use these resources for business interruption grants. So there's a lot of uses for that. Steve, Commissioner Wooden, thanks for putting your questions in the chat. This was one of your questions about what our resources could be used for. And, our funds were used for inventory, fixed expenses, and payroll, no capital or facade improvements. So just want to address that question while it's there in the chat.
This was not, these are not for existing debt service or anything of that nature.
Right.
Apologize, I was on mute, but it's a question obviously can be answered a couple ways. I think we'll look at it after the criteria is set. We have both some ability in-house, and we've talked about getting some outside accounting assistance to assist us. We will just make that decision as we get the criteria in place and how we want to help these.
Right. But Steve, the question was, can we give a direct business grant to a business, or does it have to be a COVID-related expense for that business?
It has to be COVID related. It can be for business interruption. It can be a grant for keeping the business going, those type of things.
Okay.
But it's also, everything's supposed to be driven off COVID.
Right.
And that should be relatively easy to demonstrate in this market.
Yeah.
Correct. Commissioner Talon, does that answer your questions?
Yes, thank you very much.
Commissioner Womack.
Thank you, Madam Chair. First of all, I want to thank you, Mr. Villarreal and Mr. Johnston, for this great presentation, and keep up the good work that you're doing here in Kent County to help these businesses. You're welcome. One of the things I want to talk about, Madam Chair, she mentioned some of the businesses in the outer areas and regions of Kent County that have not received support. Latinx GR this morning mentioned that 90% of the businesses in their area hadn't received any funds. So when Madam Chair mentioned increasing these funds, from 10 million onwards to maybe 20 million, one of my things was when I heard you mention that some of these businesses would probably, I think Mr. Johnson mentioned some of these businesses would probably do better with 10,000 rather than 20,000. But I was thinking, would it be better to try to reach more businesses so we don't have so many people left at the table with an empty bowl as these businesses try to recover? So that was my first question.
Yeah, and I think Commissioner Womack, I don't want to speak for you too much, but I think you're saying if we increase the total dollar amount, but decrease the individual grant to help more people, is that impactful to the business? Is that what you're asking?
Yes, that's exactly what I'm asking. But what they've been given is fine. But if we're giving more money instead of increasing that per business, can we reach more businesses?
Yeah, so our recommendation is, our guidance on that is a bit of a sliding scale based upon employee count and revenue, right? So if you're a very small business, a small amount can go a long way to paying, maybe a couple months of rent. That changes as you get bigger. Looking at our experience, the United Way's experience supporting nonprofits, we want to be impactful. So, 5, 7,500, 10, 15, 20 is kind of those range of grants that we had initially thought could make a big difference. And then given the amount of money you're talking about, that could go a long way, right? You're looking at 1,200 businesses, at like 10 million. And then you double that, that's 2,500 businesses. That'll go a long way at that kind of level. Again, that's back of the napkin, Chicago math kid, trying to figure that out. But I think that's what we ballparked we could hit.
All right, we've got a couple more commissioners with questions, and I do want us to kind of try to move forward into our agenda. So Commissioner Jones.
Thank you, Chair Bolter. Can we discuss for a few moments that business interruption part that just came up? I would think many businesses have that component. Is that something that we discuss here? We have as a component of this, or is it more, going forward, how do you open and manage? Because when I think of a restaurant, I think of one that might need a drive-through. I think of one that might need a tent, tables, particularly restaurants. I'm also, along the follow-up to that is, what's the number that we're talking about for businesses in the county between that 5 and 25 employees?
So,
Dante?
Yep. So the 5 to 25 employee count probably represents about 80% of the businesses in this county. So it is in the thousands. That's the majority of the businesses that we see. The interruption portion of it, absolutely. So if your business is not allowed to operate because of COVID, and you need to, make modifications, add additional equipment, and so on, that would be a very acceptable way of utilization of the funds. It's not for for existing debt or other existing projects and so forth. It is to respond to the challenges of working under the COVID conditions and environment. And then the other thing I'll share is that we do need to establish that you have been impacted by COVID. And I'll share with you why. Because again, every dollar matters, that it goes to the businesses that need it, that have been impacted. If we had a business that was declining in sales and maybe about to go under, should they receive $10,000 because it happened during the COVID time? That's why we require to see the financials to really understand, were they in decline, were they steady, or were they in the uptick? Because we wanted to go to all the businesses that need it, that really need it in these critical times.
Diane, we've got Matt Nelson here from Warner who can also answer that specifically. Matt? Unmute.
It took me a second to come off mute. Yeah, so the Department of Treasury's guidance with regard to this is, as Steve was saying, that business interruption is covered, and the scope of what's allowed within the business interruption category is quite broad. So within this context, the criteria that the subcommittee creates, there's not as quite as many restrictions as there might otherwise be thought, except that it has to be related to COVID and typically from the closure of the businesses because of the stay-home order. The vast majority of the businesses in Kent County are going to have expenses that are tied directly to that, so it shouldn't be hard for them to provide appropriate documentation to ensure that we're complying with the requirements of both the Treasury guidance and the statute.
Does that answer your question, Diane?
Yeah, can we circle back on the number of businesses that we are dealing with? What is that what is that number between 5 and 25 employees for the county? Does the chamber know, not just chamber members, but for the whole county?
Absolutely. So I don't have the numbers in front of me. I can get back with you to get you exact numbers, 5 to 25 that fit that criteria. I can get you exact numbers. Yep.
I mean, I think that's helpful, but we do know that that was your criteria. We do know that that size business has been helped already. And, you know, I think that we also are looking at micro businesses that haven't gotten anything under 5 employees. You know, what is that number? And what is the number of 50 to 100 who maybe they need PPE or maybe they have something specific. So, you know, if you could get us those numbers, that's great. But we know that we're not going to be able to address all of those.
When this hit, we reached out to the Kent County Health Department. They got a list of just the restaurants. I mean, that's over 2,000.
How much?
Like 2,000.
2,000 restaurants, yeah. Okay, Commissioner Jones, do you have any more questions for them?
Nope.
Commissioner Skaggs.
Thank you, Chair. I mean, I got a bunch of questions. It's great to see you guys. One, I just want to stress what Andy mentions, that I think it probably makes a lot of sense to have, you know, if we're asking these people to give us some detailed numbers, which I think we are, on the state of their business, that sort of be held internal. But that once we have disbursements going out to companies, that we make sure that we got, you know, full transparency on who got them and how much they got. Two, you know, wondered if you all have thought about actual names for the screening committee, or at least, you know, where you would be looking to get them. You know, we saw the screening committee for the Right Place, certainly an impressive group. I know I've talked to Andy about some of the hopes that I was looking for to be on that screening committee. So, you know, when would that be coming up? And that'd be something I'd really like to see. And then, but I guess my question is, what is your suggestion from the criteria that goes beyond the criteria that you use with that first round of private funding? I know the Right Place had some lessons that they shared with us. One of the criteria that I really liked was that if they're, you know, if we have limited funds, I think we, you know, they were stressing businesses that had been, you know, deeply engaged in the community in some way or another. You know, I think certainly a criteria would be, as I talked with Andy, you know, businesses that had, you know, been in compliance with orders and laws around this. So, you know, if Tiger King has reopened, I don't know that we want to be giving Tiger King taxpayer dollars. And so, what can you go over some of the additional criteria that you're considering as we move into a larger amounts of businesses and a larger dollar amount?
Mm-hmm. One of the things that I've been looking at is that 0 to 5 employee size. I think that is a business demographic that has had trouble connecting to any of the other resources. What I would also put as a criteria is, what I would recommend, not that this would discount you in applying or receiving funds, but your points would be lower if you have already accessed any of the other grant funds, loan funds, PPE, SBA, and so forth. I think it is important for us to get the resources to those that have not been able to access, and there are many. And what I'm talking about here is businesses that aren't as sophisticated and weren't readily able to connect with their banker and have the financials ready to go and so forth. That's why the technical assistance and hand-holding is critical for this process. And then I want to answer something that came up, I think, a couple questions prior. We do have a 30, 60, and 90-day follow-up. At the 30-day follow-up, we do establish the use of the funds, or need to be accountable to how were the funds spent, and we document that. Then 60 and 100 days for the technical assistance that we provide. Are they implementing? Are they meeting with their coaches and counselors that we've connected them with, and so forth? So it's not just work that we do up till they get the check. It also continues afterwards. And then as far as the screening or the screening committee or review committee, what I would recommend, these be individuals that broadly represent Kent County, not only industry backgrounds as well. I also feel we need to have an equity lens. Those that are representative of our communities of colors, but also who understand and work and are passionate about small business in our community.
And I would add that represent workers too and employees, because again, as I started, I think that that's a big thing of what this is about. So, you know, union representation, being on that committee. You talk about criteria. I just brought up our metric again. I think one of the things we've learned is, you know, are they sustainable? Are they impactful for local jobs? And do they, you know, contribute to the, you know, are they a pillar of their community, right? Are they important to that community? So when we think about the selection process, if we divide it up geographically, to make sure that there's somebody from that area that knows that area pretty well, not to have a bunch of homers on that one selection committee, right? But to have people with that local knowledge. I also think we need to reach out to our other ESO groups, the other business association groups, to have them give us recommendation for members with those financial backgrounds as well, so everybody can have a piece of this process. I think the biggest question is, you know, feeling like, you know, if you want, when do you want us to move forward with putting the pen to paper and really, you know, moving? Okay, the chair's saying now, so we can put that pen to paper and come back with very detailed structure of the outreach committees, selection committees, and then the rubric. I think probably better in a smaller group to just hammer out some of those finer details, but that's my thought.
How soon could you get that done?
It's Thursday. You know, give Dante and I over the weekend to have a really nice draft. I'm not going anywhere. This is where I work.
We can have something by Monday.
Yeah.
Okay, any other questions for Dante and Andy before we let them go?
Just Chair, if I could, and it is just a question, just to follow up to what you mentioned and what Commissioner Jones mentioned. As far as those numbers that we get, I mean, I get that 80% of businesses have, you know, below 25 employees or between 5 and 25, I guess, and this may be, you know, beyond the scope of the system of government and probably the system of the chamber that we have. But given that a big part of our stress here is, you know, getting businesses back up and getting employees back to work, that I'm as interested in the absolute number of businesses. I'm also interested in the absolute number of employees. So, you know, you have some business that, you know, that's maybe not a mom and pop, but has, you know, maybe it's just a couple of lawyers or something, and they make a ton of money. But, you know, they were able to work remotely, versus a business like a restaurant, which may have a lot of employees, some full-time, some part-time. So it would just be nice to have some rough numbers of,
well, and
are we helping these businesses, and do these businesses really bring value when we're thinking about employment?
or should we also consider a component of the employee where how many did you have to furlough and how many are you calling back, or something like that in there? Because like you said, there's a law firm and they all work from home. Yeah, they're closed, but they're all still generating revenue and no one's on furlough, versus, you know, we furloughed half of and we think we can bring them all back, or we think we can bring 50% of them back, or whatever it is. But I don't know if that's something too. So I don't see any more questions specifically for Andy and Dante. I do have a suggestion for us to move forward on this. So if there are no other hands raised for our chamber friends, we will proceed to the agenda. Thank you guys so much for coming.
Thank you for the opportunity and appreciate the homework for over the weekend.
Sorry.
Thanks so much.
Thank you. All right, so we are on this this number 4 item, and I just want to throw something out to our subcommittee. I want to get going on this. What I'm wondering is if when we go to the next agenda item, do the members of the subcommittee feel comfortable plugging in a number for now of what we think we would want to do for that bucket? And do we feel comfortable engaging formally the Grand Rapids Chamber to do this? For now, just make those 2 decisions, and then they can get going. And then Tuesday we could formalize our criteria for this process, because I think we all could have time to digest what our criteria could be. We could all submit those to Wayman. We could have a formalized list and the formalized list of criteria ideas from the chamber, and just kind of cross them off or keep them in and move forward. But today we could still agree on a number, and we could agree on engaging the administrator to do it. Does that sound okay with the subcommittee?
Madam Chair, this is Talon. Can you hear me?
Yes.
Wow. Plan D. I'm comfortable with a certain placeholder, but I'm pretty uncomfortable with a very large number at this point, which it probably needs to be, without resolving the local units of government piece. Because I feel like our kind of broad look at where the buckets are, that piece is way, way below what it's going to need to be. So if that has to be bumped up, I don't know where that would come from if we bump this up as well. So I would want to have the discussion in that context.
Commissioner Skaggs?
Thank you, Chair. Yeah, I mean, I think I'm comfortable in the sense of, putting the chamber on notice that in concept, we're ready to have them administer this. I mean, obviously, there's a lot of meat to put on these bones, which I think we can do as far as criteria, as far as engagement with other groups, as far as looking at auditing and oversight and the screening committee. And there's a lot of details here, but I think that you're absolutely correct, Chair, that we want to get them to work. And so I'm comfortable in saying that we can do that in concept. I agree with Commissioner Talon that, I guess I'm going to say I agree with both of you. We need to put a number on this. I think we need to put a number on it that we feel is in the ballpark of where we're going to go, maybe on the low end of that ballpark. But we do have a lot of other issues that we want to discuss as far as testing and tracing and childcare.
Well, we have to get to the next agenda item, which we will start looking at that. I just wondered if we can proceed to that, but I just wondered if we have to provide them, and I said this 2 days ago, with some semblance of a scope, because they're going to have to know how many selection committees they need. If this goes from 10 to 20 or 10 to 15 or whatever it is, they have to start. It's just a lot of work. So it changes the scope.
I think I'm comfortable with what we have in the draft at 10, and until we see where we're spreading.
Okay. All right, Commissioner Steck.
Yeah, so the first question is, are we prepared to identify the chamber and this process that they described as being the mechanism we want to use for distribution of funds in the business bucket? And I certainly am. I think that this is the most effective way of doing it, and I would I would support authorizing them to go ahead immediately, whether it's over the weekend, that's up to Andy, but at least moving forward immediately to identify the details of that so we can get that process moving. As far as how much we put in the bucket, at least for purposes of giving them the planning profile, 10 million is a nice starting part. Some of my colleagues may think that's too high. I think it's too low. But for purposes of planning, it probably is a good place to start.
All right, Commissioner Jones.
Thank you, Chair Bolter. My answer is yes. I think the Grand Rapids Chamber is the best partner to go ahead and run with this. As far as the amount on the bucket, as I've been kind of asking for numbers, I think the 10,000 out of the 114 million we've received is too low. I think this is a rubber meets the road type of funding that will really make a difference in our community. And like everything else with budgeting, there's going to be more need than what we're going to have funds. And I think that's just a piece we have to accept with this and find the spots where we can say we did our best due diligence across all the needs. So with that being said, keeping it at the 10 million, if you have 2,000 applicants, they each get $5,000, boom, you're at 10 million. And I believe we just heard from Andy and others that that's not enough to make the really big impact we're looking for. So I would like the committee to consider increasing that bucket now and not leaving them with a $10 million bucket to work with.
Commissioner Breeby.
Thank you, Chair Bolter. I agree that I do think the Chamber is best equipped to move forward with this and distributing these funds. And I, also agree with Commissioner Jones. I think, 10 million is a good number, but I think we can make a better impact. And the number that I've been kind of thinking of, and it was mentioned earlier, was 15 million. And what we have to keep in mind is that these companies, these businesses are going to be driving our economy forward, and we're really going to need that. So we need to support them and with the goal that they will, help bring our economy back with their employees spending money, their business growing. And I think it's just really important to put our best foot forward at this point.
Commissioner Womack.
Yes, I also agree that the Grand Rapids Chamber of Commerce would be our best partner to do this work through. They've proven throughout the years that they are there for the businesses. They're already set up for accountability. We worked with them in the past, so I'd be very happy to work with that today. Also, I'm very happy that they are looking to have a committee that may include some of the county to help, oversee some of this, especially in my community when we see committees that may have one or two African Americans, and we really believe that that is helping the diversity. It definitely does. But as I say, with me working at a radio station and 100% of the businesses that advertise with us have not received any funds. So I just think we always could do a little more for the outreach, but that's not taking anything away from the great work the Chamber and the county and everyone in Kent County has done in diversity, because in the last 10 or 15 years, there has been a great deal of diversity in Grand Rapids and Kent County in the greater area, and everybody sees it, and I want to acknowledge it. So I'd be very happy to vote in favor of the Chamber today. Thank you.
All right, so kind of what I'm hearing is there's consensus around engaging the chamber. So if they're still on, please take that and run. And then I think we all agree that 10 is probably at least the starting point. So once we get to item 5, we can start going down that list. We can move things around and discuss this. But I would like to see us go to at least 20. I want to remind everyone that we probably all agree, and I know it was mentioned a couple times, we have to give all these organizations some sort of administrative fee to do this. So, you know, there's money right off the top. And again, you know, we're spending 10% or less of the amount that we're getting on business relief. So, you know, I just want to remind us all that this is what's going to help everybody's budget. This is going to help the economy. This is going to help. And to only apply less than 10% is kind of disappointing to me. So anyway, okay, well, we're going to move on then. We will formally engage the chamber. I will ask them to bring their criteria. I've written down quite a bit of criteria that I've heard from all of the board members. So we'll start to circulate that list. Hopefully we can start that tomorrow, have it to you by Monday at the latest to go over that, and we can kind of fine tune that. I do want to engage Warner, and obviously all of us on this subcommittee are very concerned about equity and making sure there's no discrimination in any of this selection process. And so to the extent that Warner can give us advice on how to, you know, utilize the criteria in a way that complies with federal requirements of what we can and cannot ask in our application process, I would ask them to engage in that as well. So with that, if everyone's all right, I'd like to move on to item 5 on our agenda, update of COVID expenditures.
Madam Chair, you have a copy. Let's see, make sure I'm on. You have a copy of the updated track of expenses. Is it 5.9 million at this point? And then also you have a copy of the internal COVID sources and uses of funds report, as well as the sources and uses of fund reports other. So those documents have been updated for you in the folder.
Okay, so Wayman, can you go back to the first document on our county
Sure.
expenses? I know Commissioner Skaggs and I have went back and forth a little bit on some of these questions, and I'm hoping that somebody from the health department is here. And Commissioner Skaggs, I don't want to speak for you if you want to ask your questions, but we did have some concerns that, you know, are these expenses, like for instance, I don't know where it is if you scroll down, the jail expense, you know, are we going to get more detail on what that is? Are we going to get, I don't see it on here now.
Yeah, we have that detail. We do have that detail, that backup. This is just a run up of that, of
Yeah,
those numbers.
Because there is some concern that the health department, are we, you know, when we're selecting the amount that we're applying, is that all of the contact tracing they need to do through December and all of the testing that they think they need to do? And Commissioner Skaggs, do you want to weigh in on some of those questions?
Yeah, I just thank you, Chair. I just think last time there was some discussion that there did exist a little bit more detail, and now I'm moving on to not to what we spent currently, but what the full 114 million budget is. That spreadsheet.
Can we go to that document, please?
Yeah. You know, so I'm looking at that and I'm thinking, you know, public safety is at 12.7 million. What are we spending that on? And then as Chair Bolter said, you know, I really think that one of the ways that we're gonna get this county back on its feet is to make sure that we've got the virus itself in as much check as we can, so that we have the lowest risk possible, so that we have the highest consumer confidence possible, you know. And therefore I just want to know, like, what are we getting for the 2.1 in contact tracing and for the 4.9 in testing, and is that getting us to you know, the levels that we think we need to be at? I know there's a lot of different organizations that have different senses of where we should be.
Sure.
We're probably at a place where there's never going to be too much testing. I mean, I don't want to get a swab stuck up my nose every couple of hours, but I think that knowing the details of where that money goes is going to help us
Okay.
We try to get close to where we want to go on how we want to spend this money.
I'm not sure if Adam's on the call, but I hear the questions and we can provide you the detailed response that you're looking for on those items. Steve and Adam, are you on the line? Adam's not, I don't think, but I believe, Steve, you're there. Steve, are you there?
I'm on the line. I'm sorry, I didn't know that question directly. I thought it was Adam. We did ask both the major departments, the health department and the sheriff's department, to try and map out what their expected expenditures would be between now and December 30th. They provided spreadsheets that mapped out what they expected to do. The high level is on that graphic that's up on the board now for the health department. I also did another graphic that is not there right now, but can be provided, that shows over the time period in which they expected to spend that money between now and December and how they would spend it. So we can provide a lot more detail if you give us a little time to put it together. The health department.
What I'm looking for is in addition to the budget dollar numbers, what we're actually essentially buying. Like how many tests a day are we getting? How many employees doing the contact tracing are we getting? Which I don't even know what the best practice number for that would be.
Those budget numbers are broken down by wages, testing, any equipment they need to buy, PPE, that kind of stuff. So it goes down to that level.
I think we're going to need Adam for this.
Pardon me, I didn't hear that.
I think we probably might need to Adam and the sheriff to tell us what is happening beyond these numbers. I don't just need the numbers. I want to know what we are buying.
Yeah, so for us to move forward on these bucket items, I think we are going to need some of that more detailed information. The 12.7 number is a high number, and I'm certain we have an accounting of it. I just need to know what that is. But I think we can say that we think roughly our expenses are going to be roughly $40 million to Steve's best estimates based on what we know. Now, contact tracing and all those things, just in my experience on my other job, I mean, these materials change in pricing, they triple, quadruple, the change in availability, the test kits change. Technology changes, so we could start off thinking we're going to spend this much on it and then need to spend much less, or something new comes up. So I get that these are estimates.
Yeah, we can provide you the granular data, plus we can ask that Adam and the sheriff meet with the subcommittee on Tuesday.
Yeah,
if that would be fine.
Does that help, Commissioner Skaggs?
Yes.
One thing that Gail has shared with me is that the rules and the guidance keeps changing too, and how we have to shift money around and what we have to do to stay compliant. So there's a lot of change going with these.
The other thing that I want to be mindful of in our county expenses is that a lot of these neighborhood groups and local groups that came before us, a lot of the things they're requesting are health department services. So are we baking those additional costs into that, or are we just going to take what we think we need and maybe we can redirect it into neighborhoods? But it's all stuff we're already doing, and I just want to be sure to know is that we want to be sure that the health department's working with all of those groups that presented, but then are those requests over and above what we've already estimated, or have we taken account of that and we just need to redirect and partner with those organizations?
We will confirm that. Here's the dilemma that we have. We're attempting to put as much information in front of you to get through the exercise of at least having the buckets, and knowing that we will confirm that there isn't any duplication, any overlapping that's going on before we release the dollars. That's going to happen. So when Adam and the sheriff comes on board, we'll ask them to confirm that there isn't any duplication. In fact, we're going to work with them to make sure of that. we will
Okay.
pull in Gail Brink, we'll pull in Randy
Okay.
at the
Yep.
sheriff's department to make sure that none of this overlap is occurring as
Okay.
we allocate the dollars.
Okay, let's move down then on community investment, 48 million. We've got the small business grant dollar amount at 10 million. We've discussed this. We're gonna use that as a placeholder, but we need to finalize that number. I am concerned that the return to work PPE, though that was an initial $2 million, that we may need to really vastly increase that number. So I think we wanna consider that for Tuesday. Maybe Cal can provide us some more detail on that. But, you know, I just don't know that that was our understanding, that was the starting point. So what
Yeah,
is
it is
that
a starting point.
additional number? Okay, then moving down from there, our mitigation of homelessness, I think those numbers are pretty solid, and we've talked a lot about that. Don't know if anyone else has input on that, but we have a lot of funds for this, and we've talked a lot about it. Care for vulnerable populations, to my understanding, Steve, these are placeholders. Do you want to talk a little bit about these lines a little bit more?
Yes.
Since the last time we looked at this sheet, there has not been many changes. I will point out 4 for you. First of all, I went through and cleaned up the sheet, did some formatting stuff, make sure it looked a little better. The 4 I have is about halfway down the page on the left-hand side. You see community investment, 48 million. What I pulled out of that was the reserve in the bottom, because technically that hasn't been allocated. I don't know if it's going to be allocated up to the county or allocated to community investment. So I just pulled that out. So we didn't lose any money, but I thought somebody might notice it didn't say 74 million anymore. So I wanted to touch on that. Down the page a little bit for care for vulnerable populations, I added 2 more tentative placeholders. One was for basic community needs, example being utility assistance, purchases, personal products, etc. Why I don't have a community partner in mind, and that's sure. Bailiwick, I thought that would be something like maybe United Way would take on, or some other community partner, but that there would definitely be a need in that area. At least that's what I hear people saying. Below that, I had communication and informational guidance. There's been a lot of talk, for instance, of a 211 that does that type of stuff for us. So there is a placeholder for those type of activity. The biggest one I wanted to point out for is the bottom line reserve for second wave target. I have put in a preliminary, our target was 20 million. But if you look over to the right, our current availability is $26.5 million. So I would point out, if you buy into the $20 million target, if you move 10 million up to, say, small business grants alone, you will be down below your target by $4 million, because that would take us down to 15. So I just want to point out, as we move numbers, that target, that availability number will change up and down.
Okay, but I do want to also point out that some of this mitigation of homelessness and some of this vulnerable population funds could come out of potentially those other sources of revenue or grants, correct? This might not all come out of CARES if we can apply those other funds,
right?
How they're restricted to be applied.
That is correct. If we identify a lesser need for these funds, whether it be another funding source, whether it be category B FEMA funds or contributions from the community, or in fact, we overestimated the need and we don't need as much, then these funds would be eligible for redistribution to other board priorities.
Okay, and then lastly, and then I know Commissioner Steck has his hand up. If we scroll up, where is the, to Commissioner Talon's point, where is the other municipality funds?
That's beneath, that's down below.
That's the 17 million.
It's 17 million. That's assistant local governments. That's
Oh,
where
I
that
see.
is.
Okay,
Yeah.
yep. So Wayman, can you talk about a little bit about how you came up with that number? Because obviously we've seen what's been submitted. Can someone please mute your phone? Thank you. Please mute.
The number came as we were looking at what Oakland, Wayne, and Macomb County were doing across the state. And if you take a look at what happened in Macomb, for instance, they have a city, Warren, third largest city, for instance, they have a 134,000 populace over there, and they have identified $10 million for all of the municipalities. I think there's like 30 plus municipalities over there in Macomb. So what Steve and we looked at was, similarly, how should Kent County respond? We took that number up from what we were seeing across the state because we wanted to make sure that we were progressive about helping our core cities. And so that number represents 15% of the total. And I believe, Steve, if you've got any other additional intel on that, but that's how I understand we came up with the number.
And I think the other thing we have to be aware is there may be some overlap in requests for the services
Yeah, that's right.
reimbursement for what we're doing. For instance, economic stimulation or helping small business, I believe was a part of the request we received from Grand Rapids and maybe other communities. So who's going to administer that program, or we're going to throw money at it twice? So we need to evaluate those things.
Yeah, and I just want commission members to know that I did speak to Mayor Bliss last night, and it was a very warm conversation, and I think that there was a miscommunication of they are so concerned about business relief. I mean, that's what I've heard over and over and over from them, that I think they thought that needed to be included in their submission because they weren't really sure what we were doing. So we talked about making sure we're not duplicating efforts, not standing up two different of the same processes. So I think once Wayman and Mark kind of go through that, and now that they fully understand what we're doing, because we didn't get to it till today.
And I haven't had a chance to sit down with Mark. He sent some information yesterday, and what we're going to do is sit down and understand the numbers. Me and my team are going to meet with him and his team, and we're going to
this 17 figure could very well work. It's just we had some duplication on what everyone wanted to do. Plus the DDA is going to be doing a lot of business relief, as we saw for that downtown corridor, and a lot of the things that the city wanted to expense for out of the DDA. So I think we're pretty close to target on that. So I guess
let me correct something too. Evidently, Mark sent something last week, Thursday or Friday, that got hung up in email. It was sent to Jeff. I asked Jeff to follow up with the city when they first submitted their information, but it got hung up. It went to a different email address or whatever. So we never got the information until yesterday. So we weren't clear. But we will be following up with the city of Grand Rapids today, tomorrow, to affirm that.
Commissioner Steck has a question.
Yeah, thank you, Chair. So I'm assuming that we're sort of in this conversation about where we want to land in our bucket allocation, or at least we're heading there. You asked a number of the questions that I had as I'm going through this master list here, and I do have some other follow-ups if I could. And maybe starting with the bottom. I know that the target for second wave is 20 million, and I'm not sure I understand the science behind targeting 20 million and why we think that is the right number. And I put that in the context of, we certainly know today that the need for business response and stabilizing our business community is not speculative. It's not something might happen. It's current. It's direct. It's a currently understood need. So I'm just concerned about holding back 20 million for a potential in the future when we're looking at underserving what we know is a current dramatic need now. So maybe if you could talk a little bit about how you come up with the 20 million.
Stephen, can you respond to that, please?
Jess?
Yes, please
Okay.
respond.
You know, it's not rocket science, okay? The 20, again, from looking what other communities were doing, seemed to be a, quote, reasonable starting place to do that. For instance, the city of Phoenix put aside, I think, 50% for that. I thought that was way too high for us to do. So I picked the number. Could it be 15? Could it be 25? Yes.
Yeah, it could be 10. I mean, it's just.
Yeah.
Yeah, again, from my perspective, I'm looking at the significantly undermet needs of what we know is out there today versus holding back money for the potential in the future, and that's a tough balance. But
yeah, when you think about what's happening in the community, how we're at least appearing to be performing and resolving the curve and knocking it down, people seem to be reasonably compliant to what the executive orders have been. I don't know. Hopefully, we'll find a cure, but if people continue to keep their distances, and if we do well bringing people back to work, we've got the Return Back to Work Safe program that we're instituting for businesses. A lot is going on to mitigate potential upswing in the COVID pandemic again. So it could be that we are overstating it, but that was the number we had a week or two ago. It could come down based on the current conditions.
well, I would be inclined to take it down, primarily not because it's unreasonable to put money aside for that potentiality, but in the face of the dramatic need that we know is there, and we have to get our business community back stabilized. That not stabilizing that because we need to hold some money back for the possibility, to me, would not be the right equation. I do have, and at the risk of alienating some folks, I'm adding up the pockets of funds that we have here to address homelessness. So you've got mitigation of homelessness, 3.5 million, 1 million, then the 500,000 we approved last time. And then the temporary housing on the first category, which is, I think our expenditures already incurred at 4.3 million. And I think I saw the detail in the new bucket of 5 million for basic community needs. It's not here, but I think in the other detailed reports, that included also rent assistance and so on as part of the components for that. Again, addressing all those issues, obviously important, and they're here because they are important. But putting it in context, how many folks are we touching with all of those components, which add up to probably $10 million compared to the $10 million for all of our businesses in that bucket?
I can't give you that number right now. How many people are we touching? But I could try to assemble something to tell you what the number of people are. But you know, numbers of people doesn't necessarily equate to the number of need. I mean, there's a numbers don't equate to the actual scenarios that get played out. But we can try to equip you with that.
Well, yeah, and I'm not looking for a precise number. And maybe I'm just asking the question without the need to have an actual answer to it. But to me, it's relevant to begin to look at proportionality here with respect to addressing the needs of that, and it's an important need. But so are the needs of employees to get back to work so they can support their families, and the needs of businesses to have sustainability so that they can be there the end of the year and next year and the year after that. So just trying to put it in some kind of context that makes it reasonable to make these allocations.
Okay, we can do that. We'll work on that, Commissioner. Absolutely.
Mr. Talon?
Thank you, Chair. I want to agree with Commissioner Stack on what he was observing there, and I recognize that the basic community needs line item, as Steve Duarte indicated, is there's not any basis in data for that. It's a number that he kind of picked out, and I recognize there clearly should be would be some duplication with the mitigation of homeless dollars. So I think we need to look closer at that. But I also think I really need to see. Are you still hearing me?
We lost
Okay.
you for a second. We heard you say, I really need to see.
Yeah, then I stopped because a message came up that I was muted. I really need to see that additional work on the request or the summation from the city on their needs, because I think we need to reimburse them or provide them with funding for the costs related to COVID, and recognizing there's some overlap. I'd like to see what that is. I think that's a significant issue we need to take a look at before we start moving things too much among these buckets. When I look up on that sheet and look at under the county expenses, public safety and correctional facility, if you take the correctional facility, how much are those public safety costs? We know the city of Grand Rapids probably has at least as much COVID-related public safety costs as our Sheriff's Department Road Patrol does. So there's a number of things like that that I think are significant Grand Rapids costs that we need to be clear about, and I want to make sure those get reimbursed. If we're reimbursing ourselves 100% for our COVID-related expenses, we ought to be doing that for our local units as well.
Yeah, and like I said, I think there was a miscommunication on who was going to do what on a lot of those items. So I would ask that we give Mark and Wayman time to meet. Like Wayman said, we didn't even get the submission until before that.
Yeah, let me. There's.
So let's,
yeah.
Let's give that time to work and not micromanage that too much and see what comes out of that. There was also that outlier in Algoma Township that we need to circle back with.
And they did submit. We got something from them today. So
Okay.
Evidently, what they provided us was the first time, not the second time, and so now we have numbers from them. So we do have that, just as an hour ago.
So we need to make sure that the requests are fully compliant with the CARES usage, and I agree that we need to fund as many. Can we mute that sound? I agree we need to do that, but you know, again, we've got essential needs, we've got small business. We are going to probably have a bigger PPE bill. So I guess I would like us to move on. I see Commissioner Steck has his hand up again, but I do want us to try to move on. I don't know what I'm looking at here, but and Commissioner Womack.
That's just the buckets. Yeah.
Can we go back to the agenda? To get us through this, I think we've got our homework on our chamber, our small business criteria. We'll get that. Wayman and Mark and others are going to fine tune the municipality submission, so we'll have that on Tuesday. I would like us to move forward on finalizing those numbers. And when I say finalizing, they're not final numbers. These are estimates. They're not bills. We don't have the bills. These are kind of the guidance for the board to know that this is kind of the guidance for staff of how we're spending this money. So we've got to start moving on this stuff, and I know we've got a lot of work to do, but I would like us to try to get there by Tuesday. Commissioner Steck.
No, I took your admonition and lowered my hand.
Well, do you have any further information you want to share?
You picked it on me a little bit. I just some continued concern about what I see in the spectrum of responses or asks from our municipalities, and it's absolutely clear to me that they're not all using the same yardstick, and that's okay, I guess, in the sense that we gave them an opportunity to identify what their asks are, but I think that we need to be mindful of that when we get a little more granular on particularly these large numbers of 30 million and so on.
Right. Commissioner Womack.
Yes, I think it's great that Administrator Britt and our city manager, Mark Washington, are going to meet. And I just look forward to receiving any of the requests and information from Grand Rapids, as well as I know it'll be sent out to the other commissioners once you have that available, with them making up a third of our population in Kent County. I also think it was great that some of the commissioners mentioned that, I think it might have been our administrator who mentioned he's going to be making sure we go through line items and we're not paying twice for different things to be done in the county. So I just want to thank Administrator Britt for all the extra work that the staff is doing. Thank you.
Okay, so we've got the to-dos coming out of this are a more robust and granular information on the county expenses, more work on the municipality submission, our criteria that we're all going to submit if you have specifics above and beyond what we discussed, and try to get that from the chamber as well over the weekend to discuss on Tuesday and finalize. And then I think we need to kind of decide what we want to do on the business, if we want to keep it at 10 or bump it up. I would advocate that we vastly increase it, but so with that, is the committee good with that timeline? Are we like to hear from you?
Commissioner or Chair, this is Steck. So what we'd be looking at doing is finalizing our bucket allocation. In other words, we've got, I don't have it in front of me, but 6 buckets, I think, is probably what's up there. And what we need to do is to come to closure on how we're going to allocate the $115 million between those 6 buckets, recognizing there's more detailed work with respect to how you're going to actually parlay that out into the community. But that's the focus of what we want to get done by Tuesday.
Yes, so that we can submit that to the full board for approval, and staff can start to begin the work on getting this implemented.
Thank you.
Chair, this is Talon.
Yep.
I'm comfortable with moving forward with the 10 million for the business. I really would appreciate if we could wait until we have that municipality data nailed down more on Tuesday before we adjust that, so we can adjust it in the context of a more clear picture.
Okay. Yep. Commissioner Skaggs?
Nothing. I'm comfortable.
Okay. Commissioner Breeby?
Yeah, I'm comfortable too.
Jones?
I just wanted to add one small piece. If we could have a circle back at some point on the zoo we own and that little component. I don't think it's going to be, you know, a millions and millions of dollars component, but I do want to make sure that that's addressed. So I wanted to just add that to the mix.
Okay. Commissioner Womack?
Yes, I agree with the chair and with what Commissioner Jones said a little earlier about raising it to the 20 million, and I am comfortable with moving ahead.
Okay. So we might be done with these by Tuesday. So let's proceed with that. And I know these are work intense. We take a lot of time on this, but I think it's important that we get it right or get it close and proceed with that. So let's see, Carol's putting a comment about the zoo. Carol said she'll provide us a report on the zoo. So that'll be great. All right, so with that, we're on to item 7, subcommittee documents and correspondence.
Yeah, there's a bunch of different communication we received this past week that's located there. Pam, could you run through them real quick? We did receive Heart of West Michigan United Way 211 information as promised. Please scroll down. You'll see the numbers that she is relating to us. Keep moving down. And I think the number there today, they've raised over 3.3 million and has granted 2.7 million. Their request is 11.4 million for costs directly related to COVID. So that's a big number.
Okay. It's $11,400.
I'm sorry, 11,004. I'm sorry.
I just had to grab her. I just had to grab her.
You're right. Commissioner Talon, you are correct. Sorry about that. Okay, thank you.
Jim, you just saved us like 110.
Could you move on? I'm used to the big numbers. 11.4.
Yeah, we don't deal in these small $1,000 numbers.
Could you move to the next one, please?
Wish it was
Pam?
always that easy to save money.
Shit. I'm sorry. I didn't mean to say that either on the I'm sorry.
Shoot.
Shut his mic off
All right.
and delete him, Pam.
Could you move to the next? Wait a minute. Wait, go back, Pam. Okay. I think that's it related to the information from Michelle. Okay. Thank you. And then we received this information from Anessa Eddy from the K-Connect organization, and she provided us a very detailed report here about what's happening with regards to childcare in the county. And you'll have that to read. Keep going to, is that it? Let's go to the second page. So there's information, what their needs are. Stop. Thermometers, face masks, gloves, and so forth. Very much a lot of the things that we're putting in play for small businesses and that we're already providing to nonprofits. If you look down, a county investment of $1.2 million would provide capacity for the Kent Child Care Crisis Response Team. So that'll be embodied within the buckets that we've got in terms of what we will recommend will be.
Wayman, Commissioner Talon has his hand raised. I assume it's about this issue. Commissioner Talon, can you hear us?
Sorry, it's for a later issue after Wayman is through.
Oh.
Sorry.
Okay.
Okay, move to the next one, please. We received this from the Right Place. As you know, they are our economic development department, if you will. They are continuing to interact with businesses, large and small, manufacturers as well. And they were, of course, similar to what the chamber has been doing as far as supporting this review of dollars for small businesses. So they have a request in play. I think it's $500,000 to $600,000 of support for their efforts. So that's there as well. So please take a look and read that. Next one. This came from a resident in Gaines Township through Commissioner Breivy. And it's just wonderful to see that they're tracking what we're doing and recommendations relative to how we should spend the dollars. Thought that was very good of them. It wasn't a demand for funding, but simply asking us to consider how we would place the dollars in the buckets. Is there anything else? Oh, there's the City of Grand Rapids information that we received. I wanted to make sure you all had that. That's what we received from Mark Washington from the city. It gives a further breakdown of what those expenses are. And again, we're going to meet with them in the next day, hopefully today, tomorrow. We'll do it because we need to get it done, just to make sure that we're on the same page about the overlap and duplication.
Okay.
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 And what else, Pam? There's a lot that came in the last few days. That's the letter that Mark shared with me, that he shared with his city commission that supports that document.
Okay.
What else did we receive? I want to make sure we're getting them everything. Is that it, Pam?
That's it.
That might be it, Wayman.
Okay, thank you.
And I just want to thank Pam and Wayman for, again, we're making sure that we're very transparent in what is coming into the county and what this is all posted. I called through, I think, almost every commissioner. I stopped at 10:30 last night to remind them that this link is there and to educate themselves on what we're doing if they're not on the subcommittee. So, with that, Commissioner Talon, is now the time, since I'm hearing your static.
Oh, is that my static? I'm sorry. I want to reiterate what you just said, which is appreciation for this this document, this page. wondering whether that is intended to be public information or not. And I've told people this is out there, but there's not a link to it from anywhere else on the website that I know of on the county's Access Kent.
Yeah, this was received late yesterday. So Pam, with everything that we got 3 meetings going on. This might not have gotten in the packet by the time into the folder and everything else, but that's where it'll be.
What I mean is the folder itself, the page that has all of these so nicely organized. Can the public access that, and could we put a link to it from the Access Kent homepage?
I'm sure we can. It's all public documentation. Yes.
We can make this.
Are we okay with that?
I'm okay with it.
We can add these documents to the actual agenda link that's posted on the website as well.
Yeah.
I don't know if Grand Rapids will have some sensitivity only because they conveyed that to me, but if they want to pull the submission and resubmit, or if they want to keep this as the submission, then we could post it.
Yeah, I don't know. Anyone could FOIA the same information at the city or the county if they wanted it. So,
Okay.
what I wanted to make sure is I gave Mark enough time. I know we both had calls from the Grand Rapids Press or MLive, and I embargoed some of this information so that the city would have an opportunity to also be prepared for those questions that are being asked about, why their numbers, what it is, and, why is it different than the others and so forth. So I think we're good as far as the city, but let's double check that. I'll double check that with Mark again this afternoon before this gets posted up. Is that okay, commissioners?
Okay.
Thank you.
Mr. Talent, okay? Okay.
Good with me.
Yes.
Okay.
All right, can we move on? On to our agenda again. Are we on miscellaneous yet?
Yes, we are on.
All right, we are on miscellaneous. Any miscellaneous today?
Yeah, Chair Bolter, this is Steck. Just a follow-up. I noted in that report that there was, and this is part of the duplication I guess you're looking at, that there's another $5 million and the city's asked for rental assistance. So I assume that that's one of the duplications that you're going to look at carefully. And the other is, if we're going to look at the zoo as one of our cultural institutions, we probably should also explore the museum at the same time.
I can reach out to the museum. I did speak with Peter Desrenzio this morning, and he's going to provide me with some details. I can do the same thing with our friend over at the museum as well.
Commissioner Breevy has her hand up.
Thank you. Yeah, thank you for bringing that up, Stan. I would appreciate if we could connect with the Public Museum and Dale Robertson on this. I think that would be appropriate. Thanks.
Commissioner Jones?
Thank you, Chair Bolter. I wasn't looking to necessarily have us open up to all of our cultural entities, because if we do, then we should. And it's not just the zoo and the museum. It would be, the Children's Museum. It would be Frederick Meyer Gardens. My point in bringing the zoo up is the county owns the zoo. So that is a owned entity by Kent County. And I just thought it was worth raising to make sure that there is a communication input there. But I believe if we're going to open this up to all cultural institutions, then we should go bigger than just limiting to ones that are just right downtown.
Okay, but please keep in mind that if that's what the direction you want to take, we need to add that, and we're going to have to subtract money from somewhere else, or we're spending it all at once. So,
well, again, my point in bringing this up was that we own the zoo. So if Commissioner Steck and Commissioner Breevy are looking to open it up more, my point is, where do you draw that line is the point.
Oh, but my point was that the museum does have a county public relationship as well. I'm not sure whether we technically own it, but we certainly are a supporting entity through our dedicated millage.
Any other miscellaneous? I don't see anyone's hand up. Must be we're ready to adjourn.
Right.
We have one more item, public comment. Did we get any emails today or any hands raised?
Yeah, there is a email in the inbox and it is on the screen right now because it's a long email.
Can you give us the gist and we can review? Who's it from?
Don't know who it's from. Hold on. Jasmine Fuentes?
Go back up to the top of it. Jasmine Fuentes at Oakdale Park Church. Okay. Go to the top header, Pam. If you go all the way back to the top.
Yeah, this was distributed to us earlier too. It was in the
Yeah,
packet.
it's the same thing. Yeah.
Okay.
This is in the documents that we've posted.
Right.
Okay. All right. Looks like we have a comment from Allison Kohlberg. Pam, I don't know if you've got her muted.
No, she's good.
Okay. Hi, Allison.
Hi, subcommittee. First of all, so I'm Allison. I work with the Micah Center, which was one of the group of organizations, excuse me, that put together that letter that you just mentioned. So first, we greatly appreciate all of the work that you all are putting in on figuring out how to allocate these funds. And so this is a group, just briefly to give you an idea of what this is, a group of several institutions from the Grand Rapids area, congregations and community groups who are working together that had about 500 conversations recently with members of their institutions and neighborhoods. And based on those conversations and some research coming out of those, we just wanted to bring to your attention some of the key issues that arose and some proposals around how to allocate the funds from the COVID Relief Fund to address those. So there may well be funding for some of these different things in the buckets that you have mentioned already. These were just very important things to the folks from our communities and institutions that we wanted to lift up. So the key priorities there were, one, proposal for workplace safety support. So we heard from a lot of essential workers, especially lower wage workers, that even though they know that MIOSHA and other groups exist around workplace safety, they're very scared to lose their jobs if they file any kind of complaint, even if they know it will be anonymous, and we tell them that there's no danger in doing so. So they asked if it would be possible for the county health department to proactively send people to businesses to make sure the businesses understand what they need to have in place, because there's a lot coming at them, we know, and to ensure that they have in place the kinds of safety plans that are necessary for what's happening. So that was a big one. And we laid out calculations to the best of our ability for each of these for you to consider as well. The next three items are testing, training, and supported isolation. And I know you have budgets for these already, but just recognizing that, as you said earlier, the key priority here is getting the virus under control so we can reopen and have people back at work and people are safe and healthy and confident. And so from our research and a seminar we participated in with the Stafford Center for Ethics with Harvard, these were recommendations around testing and tracing levels, and then supported isolation. So making sure that people who do need to quarantine are supported and safe, and their family members are supported and safe as well to help move through.
Great. Well, thank you for that. I would, direct you to our Access Kent and our health department. I hope that you have been, kind of following all of that. They are our experts on public health. So I don't know, I appreciate all your sources for sure, but when it gets to Kent County level, they are our trusted source. So I hope that you can connect with them at some point, and we appreciate your input. Thank you. Any other public comment today?
This is Guillermo, Madam
Guillermo.
Chair. Again, I want to continue with the need, of organizations like the Hispanic Chamber and the Hispanic Center, for resources to continue our work, and supporting our grassroots efforts. Again, we are located in the heart of the community. So we would appreciate some supports and financial support for organizations during this COVID crisis. Thank you.
Yep. Thank you, Guillermo. Anyone else? Don't see any hands raised. All right, with that, we are adjourned with lots of homework for Tuesday. Have a great day.